Good evening, everyone. My name is Simran Chaudhary, and on behalf of Voice of Healthcare, I warmly welcome you all to this panel discussion Breathe Easy, Prioritizing Lung Health for All, organized by Voice of Healthcare and supported by Pfizer. As we gather during the Lung Cancer Awareness Month, this event is more than a moment of observance. It is a call to action to deepen our understanding of lung cancer and to push for progress in prevention, early detection, and treatment. Lung cancer remains one of the leading causes of cancer related deaths, according to nearly 1.8 million lives lost globally each year. Beyond the statistics, this conversation is about the lives and the stories behind those numbers and the impact we all can make together. Today, we will explore the recent advances in lung health and treatment innovation, the critical importance of early diagnosis, and the environmental and lifestyle factors impacting lung health. This discussion is dedicated to fostering a broader understanding and a stronger commitment to lung health, with the hope of inspiring communities to prioritize respiratory wellness and take proactive steps for change. And for this panel discussion, we are honored to be joined by a panel of distinguished experts who will bring valuable insights into lung cancer awareness and care. Together, let's work towards a future where everyone can truly breathe easy. I'll be starting with the introduction of the speakers today, starting with Dr. N. Kharthik, medical oncologist at Onco Foundation and Cancer Hospital, Erode. Welcome to our show, sir, Dr. Karthik.
Yeah, thank you. Good evening,
Thank you.
everyone.
Good evening, sir, and thank you so much for joining us. Dr. A.V.S. Suresh, Senior Consultant Medical Oncologist and Hematologist at Continental Hospital, Hyderabad. Welcome to our show, sir.
Thank you. Welcome.
Thank you
Pleasure
so
to be
much, sir.
here.
It's pleasure is ours, sir. Dr. Manish Sharma, Consultant Medical Oncologist at Positron Superspeciality and Cancer Hospital, Rohtak. Welcome to our show, sir.
Thank you so much. Thanks for having me here.
Thank you so much, sir. I believe Dr. Sai will join us in another 1 or 2 minutes. Okay, so Dr. Sai is already here. Yes. Dr. Sai Vivek, Consultant Medical Oncologist at Aster Hospital, Bangalore. Welcome to our show, sir. Thank you so much, sir. So, we'll be starting with a panel discussion today on introduction to lung cancer so that we would have that basic understanding what exactly is lung cancer and all about the basic awareness. Starting with Dr. Karthik. So, what is lung cancer and how does it differ from other types of cancer?
Yeah, lung cancer is basically a cancer which arises from the tissues of the lung. That is basically from the epithelial lining of the air passages which we have. So, basic definition of lung cancer is this, and it differs from the other cancer by two or three means. One is lung is a major organ which is helping in our respiration. So, if a cancer forms in this part, the patient has some breathing difficulty as the main complaint. And during that time, it is very difficult for us to have surgery or radiotherapy or chemotherapy, whatever we plan. It is again difficult for us to overcome the problems which the patient has. And this is again the leading, as you told already, this is the leading cause of cancer death among the other cancers. So we have to encounter lung cancer in a specific way so that the patient gets benefited out of it. And this is of mainly of two types. One is non-small cell lung cancer, and the other is small cell lung cancer.
Thank you so much, Dr. Karthik, for explaining us on exactly what exactly is lung cancer. Moving on to my next question, Dr. Suresh. So, what are the most common causes and risk factors for lung cancer?
The lung cancer is caused by number one, smoking, two, smoking, three, smoking. All other lists are way below the order of priority, sort of thing. Either active smoking, passive smoking, tobacco in any form is a leading cause of the lung cancer. To tell in numbers, it's 85%. That's big enough. Second thing is congested rooms. There is a natural radioactive gas called radon. we hardly give any attention to it. But if you don't ventilate your rooms well, that also leads to the lung cancer. People are worried that, I don't smoke, I have a good lifestyle. Why did I develop this lung cancer? This is one reason. Air pollution, number three. Genetics and family history, number four. And other lifestyle, number five and six. So, predominantly, quit smoking directly, indirectly, active, passive, whatever means it is. So that's a way to avoid the lung cancer. That's the cause of the lung cancer.
Very clearly, sir, you have explained that what are the most common causes. Yes, smoking is one of the biggest and most common reason of lung cancer, and people who are smoking or the active, passive smokers as well, and because of, I think the other people around the room also get affected. So I think that is one of the biggest cause, and those who are smoking should also consider other those who are present in the room. So yes, I think that's what we actually slowly or gradually are putting or highlighting those points which is actually impactful for this. Thank you so much for that. Moving on to my next question to Dr. Manish. So, can you explain the difference between non-small cell cancer and small cell lung cancer, like Dr. Karthik just mentioned about that?
So basically, lung cancer is of two types. One is small cell lung cancer, and another is non-small cell lung cancer. So this is basically a histological diagnosis. This is not a clinical diagnosis. So once you patient goes to the room of the clinician, and just by looking at the X-ray or CT scan, the clinician doesn't tell that this is a small cell lung cancer or this is a non-small cell lung cancer. This is basically patient undergoes a biopsy, and this biopsy tissue is then seen under the microscope, and on the basis of the pathology which the pathologist sees, the it is labeled as non-small cell lung cancer and small cell lung cancer. Previously, the small cell lung cancer was more, non-small cell lung cancer was not that common, but now the non-small cell lung cancer is getting more common as compared to the small cell lung cancer. Small cell lung cancers, they are very, very aggressive. Uh, oh yes, non-small cell lung cancer is also aggressive, but small cell lung cancer, they are very aggressive. And the survival rates for non-small cell lung cancer is more as compared to the small cell lung cancer. Similarly, the treatment options which we have in the today's era as of 2024, they are more in non-small cell lung cancer as compared to the small cell lung cancer. And one of the most important thing which we as a clinician often see is that the small cell lung cancer is almost exclusively seen in smokers, and non-small cell lung cancer, it is also seen in non-smokers as well.
Thank you so much, Dr. Manish, for explaining us the difference between non-small cell lung cancer and the small cell lung cancer, and about the treatment options as well. Moving on to the next topic, that is screening and diagnosis. Dr. Sai, my next question is to you. Why is early detection of lung cancer so critical, especially nowadays with if we have to see the new innovations and the new technologies has come up? So you're on mute.
I think, as with any cancer, detection of lung cancer in the earlier stages definitely adds on to the survival. So, for example, if at all we are able to treat a person in stage one, the survival rates would be upwards of 90%. Stage two, it drops again to 75 to 80. And the minute we come to stage three, the survival rates drop very drastically to 50 to 60%. And in stage four, as we all know, it is a incurable stage of any cancer. So, in this day and age moving forward, I think for anyone with significant smoking history, you could screen them with an annual low dose CT scan and pick up these early stage cancers, hence add on to the survival rates and make sure that lung cancer from the difficult cancer that has been in the past converted to a curable cancer by just doing regular screening. Yeah.
Thank you so much, Dr. Sai, for emphasizing on the early detection and how the treatment rates or the survival rate drops as a patient comes late, or it gets detected at a later stage, because all the technologies, all the innovations, and all the studies, is is done or is done to with the aim that everything can be sorted as early as possible with less pain, less complications. That's what we aim for. But thank you so much for that. My next question is to Dr. Karthik. So, what are the current screening methods available for lung cancer, and who should consider getting screened at earliest?
As Dr. Sai Vivek sir said, the screening is very much important, and I would like to emphasize that screening is done for the people who doesn't have any disease. It is for the normal individuals. It's not for the patients who complain with came for complaints with some cough or something else. So it is basically done for the normal individuals. So you cannot subject all the normal individuals for screening. We don't. We have to segregate them so that who will get benefited more should have the screening scans regularly. So US Preventive Services Task Force guidelines have said that the patients who are at high risk for lung cancer, those patients who are there in high risk are who are between 50 to 80 years of age and who has the habit of smoking, and more than or equal to 20 pack years of smoking they should have, and they should have a current smoker, or they should have less smoking in less than 15 years in the past 15 years. So for these patients we can advise them to have a low dose CT scan yearly once, so that we can pick up the occurrence of lung cancer at an early stage, and then we can treat them in an early stage so we can have better prognosis out of it.
Thank you, sir.
This is
So,
what the
my
screening
follow
guidelines.
up. Thank you so much, sir. My follow-up question on that, sir, this what you explained us about the smokers and the people who should get the screening as soon as possible. But does this new guidelines or include, or it may include in future, the people who are living in those cities? Especially nowadays, we're looking at the situation of Delhi NCR, where the AQI is 1,000 plus, which comes under the hazardous category, that it is very difficult to breathe, or it is very dangerous for their health. So does those people also come under the category that they should also get this regular screening for the better health, or avoid any complications later?
Um, Practically, yes. So theoretically, yes, but practically, it is very difficult to screen such a large population for and getting them CT scan done every year, low dose CT scan. And again, for females, it is very difficult for to do a CT often. So all these practical things are also there. So I don't think the other people who are not in the high risk setting will get benefited out of the screening. So what they can do is we can advise them about the earlier symptoms and benefit of detecting lung cancer at the earlier stage, so that if they have some symptoms they can come to the hospital very early and go and see a proper oncologist, and then they can get their investigations done, and then they can clear out whether they have cancer or not. So that would be a better approach rather than screening a very high or mass population, that too in a country like ours.
Thank you so much, sir, for clearing that out. Moving on to my next question, Dr. Suresh. So, what symptoms and or signs should prompt someone to seek that medical attention for potential lung cancer?
As rightly told by Karthik, it's very difficult to identify lung cancer based upon only symptoms. They often overlap with common diseases like tuberculosis. If you look at it, cough, fever, weight loss, you see both in TB as well as in the lung cancer. Bone pains can be non-specific. The moment these symptoms happen, like jaundice, bone pains, headache, or fits, it is already in the stage 4. So, the entire purpose of early detection based upon the signs and symptoms is not applicable in the lung cancer. The moment you have symptoms, most of the times you cross the line. That means treatment is going to be tough, outcomes are not going to be that great. Again, going back to the earlier question, what rightly pointed out by both Dr. Sai Vivek and Dr. Karthik is that screening is the key, and I am very, very eagerly looking forward for the AI driven tools where the breath analyzers which are coming up, accuracy is not more than 30-40%, but we are in the hockey stick of the learning curve. I think we are going to pick up very fast. So some of these chemicals and some of these gene derived things and proteins may throw a positive. We are always optimistic, right? So some new options for us for early detection in asymptomatic and high risk people. We may move away from the CT scans is a wishful thinking. I think it should happen. And one breath test, maybe costing around 400-500 rupees, should be able to detect the cancer early. In the NCR, I know a couple of companies doing research on these things. So symptoms, yes, we know cough, fever, no, not fever, sorry, weight loss or breathlessness should prompt you to go towards a doctor. But other symptoms indicate advanced disease.
Thank you so much, Dr. Suresh, for highlighting the important points. And I think on the signs and symptoms, I think that is one of the main reason which I can relate to. That there's so much of it gets detected at a very later stage because the signs and there's no prominent signs and symptom of a lung cancer, and as it gets detected, it's mostly at a later stage unless the person has gone for an early screening or checkups or any other thing. But like you said, we are optimistic, and I think we should be optimistic because of the all these innovations and medical advancements which is going on. There are many other tools coming up in the future that will help us to detect lung cancer at a very early stage. So yes, we all are looking forward to that. But thank you so much for highlighting that point. My next question is to Dr. Manish. So, what advancements have been made in diagnostic techniques for lung cancer?
So, for diagnostic techniques, I think we can divide this question into two parts. One is imaging, uh, that is the CT scans, PET scans, and MRIs, which we now have. And the another thing is the advanced pathology and molecular biology, which nowadays we do for our patients. So, in perspective of the imaging, we now have advanced digital PET CT scans and multi-slice CT scans, which can help tell us the exact stage of the tumor, where all it has spread. And these tests, they are very rapid tests because they are multi-slice CT scans. They don't take more than 5, 7 minutes, 10 minutes for this scan to happen. Similarly, the advanced MRI machines are nowadays there to look for the tumor which has gone to the brain. Apart from that, imaging, the pathology has also progressed very well. So, in the part of imaging, the AI is also nowadays taking a lot into the imaging part as well. It is helping the radiologist to detect the benign versus malignant lesion in CT scans or PET CT scan or even X-rays. A benign or malignant lesion can be found with the help of the AI. As the pathology part is consisting of, so earlier in not more than 20 years from today, the diagnosis was just non-small cell lung cancer and small cell lung cancer. Nowadays, we are doing multiple tests like immunohistochemistries, PCR testing, molecular testing, next generation sequencing on the DNA, which we derive from the tumor of the patient. And these help diagnose various kind of mutations which are present in the DNA of the patient's tumor and help tailor the treatment according to that. And this is now called as personalized medicine or precision medicine, what we call it as nowadays. So the advancements in the treatment has taken place just because we now have advancement in the diagnosis and advancement in the pathology.
I think so. You pointed out very great points and how this new techniques of in diagnostic is helping us to get this lung cancer detect early. And based on these new techniques, the medical treatment is also becoming less complicated and more effective. But thank you so much for making that point. My next segment is to treatment options for lung cancer, and my first question is to Dr. Sai. So, what are the standard treatment options available for lung cancer today? If we have to talk about.
Yeah, I think we are lucky to be in the era where the number of treatment options for lung cancer is fast evolving. So, as of today, the available treatment options vary according to the stages. But just to list them out, so surgery is still an option from stage 1, 2, and 3. There is radiation therapy, which is mainly meant for stage 3. Medical therapy, if I have to divide it, I would call it a threefold therapy. One, the conventional age old chemotherapy, which has been there for the last 20, 30 years. But the main caveat here is chemotherapy drugs might be the same. But the supportive care that we are giving nowadays to prevent the side effects of chemotherapy are way better than that what they were 15 to 20 years back. So this is one point where people are still stuck in the 2000s and they're really afraid of receiving chemotherapy, which is no longer the case. Apart from conventional chemotherapy, we do have targeted therapy, as told by Dr. Manish, because of the molecular oncology evolution. We're able to go to the DNA level, find the changes in DNA, and target them with simple pills. So, a pill a day could be the answer in certain types of lung cancer. And last but not the least, immunotherapy, which initially started off as a treatment in stage 4, but now has crept into the earlier stages too, is a unique treatment option where we kind of help the body's immunity get stimulated and then fight back against a foreign cell, which at the end of the day, the cancer cell is.
I think you pointed out all the right points, sir. And thank you so much for highlighting all those things. And yes, we are living in an era where we have many better and other options. And because of the supportive care, we are also able to eliminate the side effects of the treatments. So I think that's the best part. Even if we have the advanced treatments that may cause some of the other side effects, but we can eliminate that also. So, yes, my next question is Dr. Karthik. So, how do oncologists decide the best course of treatment for a patient? For example, if there's surgery, chemotherapy, radiation, or immunotherapies, we have many other options available. So, how do you classify that this patient needs this kind of treatment?
Yeah. See, basically, when a patient comes to us, as our previous speakers all told, we have to do a biopsy to confirm what type of cancer it is, and it also helps us in doing some molecular analysis in it, so that we can target accordingly. And then we have to go for the scanning part. After doing the proper scans, we have to stage the patient, because it will be the stages will be between 1 to 4. So we have to stage them accordingly based on the CT scan or PET CT scan reports. And after that, after the staging, what we would do is we have a multidisciplinary tumor board discussions, and based on the patient's stage, based on the patient's comorbidities, based on the patient's performance status, based on the patient's symptoms, and based on patient's histopathological examination as well as the molecular subtype, we treat them accordingly. So what we will do is I'll just broadly classify as very early stage to metastatic stage. So very early stage, initially the patient would go for surgery, and he or she might not require any adjuvant treatment. And the patient is having early stage, then again patient can go for surgery if the patient is medically operable. And after that, we have to supplement them with some form of systemic therapy. I'm not telling chemotherapy, because nowadays, based on the molecular analysis, we are giving chemo, and after that, we are continuing them with some form of targeted therapy or immunotherapy based on the stage. And again, the third stage, which would I like to say, is locally advanced stage. Locally advanced stage, usually we'll give some form of chemotherapy, downstage them, and then we will take them up for surgery if the patient is fit, and we will incorporate radiation if the patient is not fit. And very locally advanced stage, there the surgery would not be a part of the treatment. We have to go ahead with concurrent chemo as well as radiotherapy. And if patient has some residual disease, we can follow up them with some other form of systemic therapy based on the molecular reports. And at last, at metastatic stage or a very advanced stage, in that stage, we are going for only palliative treatment, and we are not going to cure the patient. So the systemic therapy would be the only main option for those patients. And radiotherapy sometimes can alleviate their symptoms like pain or bleeding if hemoptysis, something like that, or some brain metastasis which cannot be addressed by chemotherapy can be tackled by some form of palliative radiotherapy. So these are all the broad classification of treatment for the stages of lung cancer.
Thank you so much, Dr. Karthik, for elaborating us on what all patients would receive, what kind of treatment, and which is more suitable, and how do oncologists decide on that? Because with the awareness of the disease, we want to spread awareness about the treatment options as well, so that the listeners out there or the people who are going through this journey should also have that, the proper knowledge, that trust. Okay, these treatments are there to help us out. How does this affect our health? So that they would have that belief and trust with the process, and with that they would have this complete knowledge, and also that hope, because of how all these things are going to work, this will treat them in a better condition. So that's what we aim with the specialist on the panel. So thank you so much for
Yes.
explaining that, sir.
Yeah, we also be very happy if the patients are exactly knowing what the treatment process is, and then it makes our job very easy.
I think that's the trust
Thank you.
relationship, sir. But thank you so much for elaborating us to that. My next question is to Dr. Suresh. Sir, what role do targeted therapies and precision medicine play in lung cancer treatment? Like a bit of that was explained by Dr. Manish Sharma to us about the precision medicine.
So I'll just explain like this. We call it a fight against the cancer, right? In the metastatic diseases or advanced diseases. So in the fighting, if you want to win, you need to know the opponent in a better way. And the gene analysis is all about knowing the opponent in the right way. So, what is the strength of the cancer? Is it resistant to chemotherapy? Or what is the weakness of the cancer? That means, what are the dependencies on the cancers? So, they depend on the EGFR stimuli, or ALK, or ROS, MET. Names are very confusing, and I don't want to get into the depth of those names and therapy names. But precision medicine is all about knowing the opponent in a better way and preparing yourself with the right armamentarium or the strategy to deal with it. So it's all about take out the tumor, understand the genes. People often get confused that a gene is there or a bad gene is there, and that's always the cause of the cancer. No, it's not that. So you need to have actually a in-depth analysis of those things. You call as a driver mutations and passenger mutations. Whatever is sitting in the bus doesn't drive the bus, or whatever mutation you see in the tumor doesn't drive the tumor. So precision medicine is all about better and better understanding of the disease, and we have tons of drugs available, starting from the immunotherapies to the pills that will suit a given condition in a better way. Even if I say EGFR mutation, lung cancer in adenocarcinoma, not all of them respond well. There are some tough mutations like T791. There are mutations. Let us not go into the names, but you need to specifically pick and choose the right choice for you. And just like in the navigation, if you are traveling in the path of targeted and precision therapy, if you take a wrong route, the GPS tells to take a U-turn, right? So similarly, if the drug is not working well, or if it is not causing the desired effect, or if the side effects are more, you need to quickly stop and then have a relook into it. You need to repeat the biopsy. That's very important. If you see one mutation, that's not the end of the story. You might have to repeat it. You need to be open for those possibilities and then just go from there. Take a new path. So it's all about traveling the right path, understanding the path, and then preparing yourself to understand the opponent in a way to fight it in the best possible manner. Most of the times, these targeted therapies and precision medicines are applicable in advanced cancers. In early cancers, we don't use them that often.
Thank you so much, sir, for explaining us the role of precision medicine and targeted therapies and how it is changing, the scenario for treating lung cancer, as it is very important and playing a very crucial role at this point of time. And like you said, if there's one mutation, you always have to see for the other possibilities and how all it is going to affect. So, yes, I think because of the medical advancements and the new technologies, things are a little bit easier nowadays, and the survival rates are more, the chances are more. So, I think the all credit goes to our
Absolutely.
research.
With
Yes,
the targeted medicines, the ones which used to live for 4 months are living 4 years plus. I'm sure my colleagues will agree on that. We have seen
Yes.
the data from the Crown studies and other things where people are living 5 years plus comfortably, most of them.
I think that that's the power of
Yes.
research and the great doctors like you, which we have nowadays, and the awareness as well. So thank you so much for all your contributions, sir. Moving on to my next segment of the panel discussion, that is recovery and post-treatment care. My question is Dr. Manish. So, what does the recovery journey look like for a lung cancer patient if I have to ask about?
So, once the patient has all its treatment like surgery, radiation, chemotherapy, or presently is on some pills or some targeted therapy, the recovery of the patient, each patient would be unique. So, not all patients recover in the same way, and some times the side effects they can last sometimes for a week or even for sometimes for a month after the treatment, and sometimes they may appear after the treatment ends. So it is to be very important to remain in contact with the doctor. Most of the time, these patients they will be called to the doctor every 3 months uh, to have the physical examinations, and every 4 to 6 months to have their regular scans and blood workup to look for the late side effects or the recovery. So it is very very important to do a regular follow up appointment with the treating doctor. Apart from that, on the individual side, eating a balanced diet with lot of fruits and vegetables, exercising regularly, which we all say to all of our patients. Then practicing relaxation techniques like yoga or meditations, I think, and most importantly, to avoid smoking, alcohol, and being in having drugs. So something like so these are these all the sort of the things are there for the patients when they are recovering from the lung cancer, and the chances of lung cancer coming back increases as the stage of the lung cancer increases. So for stage 1 lung cancer, the recovery can be up to 85 to 90%, while for stage 3 lung cancer, it can be somewhere between 40 to 50%. So you have to be in regular touch with the doctor who has treated you.
So there's still many other precautions that the patient needs to, needs to take care of so that there's, not higher possibility of the relapse of the cancer, and they can still avoid that chances for that. But yes, sir, thank you so much for this answering that. So my follow-up question on that is, even after the treatment or recovery from the lung cancer, patients do come and ask and take. Obviously, they still have to be touched with their oncologist for their post-recovery period. So, have you ever come across any of the misconceptions or any myths around which patients have asked you, and you feel like this is one of the most common myths that is around or in the air that you need to clear that out?
So many of the patients they opt for some alternative treatments. Sometimes while they are on treatment, and sometimes when they are off the treatment. So most of the treatment they are not scientifically proven, and sometimes they interact with the medications that we give. So sometimes the alternative medicine can include steroids or heavy metals or something like that, which can interact with the treatment what we are giving. So I think this is one of the very very big myths which I want to clear, that the alternate medicines, I think they do not have any scientific proven role uh, as the conventional medicine. So this is one of the myths which I want to clear from my side.
Thank you so much, Dr. Manish, for putting the light on myths and conceptions around after the treatment recovery of the lung cancer. My next question is to Dr. Karthik. Sir, how can patient manage the side effects of treatment like chemotherapy or radiation therapy?
Yeah, patient. See, they can. Every treatment which we give is known to have some form of side effects. First point they have to understand is the side effects can be there, but it can be limited by having some advanced treatments in radiotherapy as well as in chemotherapy. So they can take that form of treatment, or if the patient is on therapy and if they have some form of side effects, they have to adapt some lifestyle changes in order to get rid of those side effects, and sometimes those side effects will take time to get resolved. So we have to wait till that time patiently, because what the other patient, they'll compare them with the other patients, or they'll ask suggestions from other public, and what they'll think is, see, if patient is having, for example, they're having some cough continuously, it can be sometimes due to some irritation of the respiratory tract also. It is not only due to the tumor, but sometimes they can mislead, they get misleaded by thinking of the tumor is progressing or something like that. So they have to be patient, ask, they have to come to the treating doctor and ask them what it is, and then get treatment for those side effects, and then get rid of those things. And the second part is lifestyle changes. The patient has to have good amount of nutrition, mainly because nutrition will help them to get good immunity if they are taking a proper diet with all the components like carbohydrates, proteins, vitamins, minerals and fats are in a proper manner. And they have, if patient is not able to swallow properly due to some form of pain in the throat, they can take some form of liquid diet as advised by their doctor, so that it will keep them very comfortable, and they will help in also preventing the superadded infections. One thing. The second thing is they have to do regular exercises, as Dr. Manish has said, and the exercises will help them to elevate their mood, and it will also help them to have a good feeling for them, help maintain a proper weight also. The main thing in our community is when a patient is having weight loss, they'll have some what to say, some mental thing that they are not going to get rid of the disease properly, and they'll have some thought blocks that we should have, that we should we continue the treatment or not. So weight, invariably 10% of weight loss will be there during our treatment. So don't mind about that. If you are taking proper diet and doing good exercises during the treatment, then it will not get lost, and the patient will also feel comfortable. And some relaxing exercises can also be done, because it will help your lung to get ventilated, so that the lung capacity, if it is very low, and the tumor is going to occupy and it is going to lower down your capacity again, if you're doing some relaxing exercises, it will again doing some breathing exercises will again improve your lung capacity, so that the patient will have good comfortability while breathing. So exercise will help in these aspects. And the third thing is they have to limit their alcohol intake, and they have to quit smoking during the treatment, and they have to have a good sleep. At least 8 hours of sleep per day is very important for a patient to tolerate the treatment. So and we have to also have be in a very protective environment, because you have to protect your lungs. This is the main problem many of the patients face, because the air entry we cannot avoid. So you have to be very cautious when you go out, or preferably avoid the crowded places, or going to public places during the treatment is not advised, because they can have some secondary infection. Already they'd be of very low immunity during our treatment. So during that time, if patient has some secondary infections, we have to treat those infections first. We cannot concentrate on our treatment, and it will get unnecessarily delayed. So it again impacts the results when we delay the treatment. So the patient have to wear a mask when they go out, or if their family members, if they have some form of infection, they should not go near them, and then they should sanitize them properly. And then if the patient is in a very congested room, they should go out to a room where there is proper ventilation, and then protect their lungs. So all these things will get rid of the patient to yeah, help the patient to get rid of the side effects earlier.
So you highlighted very crucial points for the recovery period, and I think all those are very important, which we all should, keep in mind because, like you said, the patient should carry or wear mask while traveling out, or should stay away from the infection person, or because in case any of the infection has been gotten up, then doctor always have to treat first the infection, and
Definitely.
then the time gets wasted and every other thing to treat the actual cause why they're suffering. I think that's a very important part rather than just focusing on the treatment, and the patient and the family should also focus on the post treatment period, which could be, if not taken care properly, then that could also become very complicated for the patient and the family. And so that needs to be, taken care and highlighted like you did. So thank you so much for that. Moving on to our next segment, that is the future treatment and innovation. My question is to Dr. Suresh. So, what are some promising advancements in lung cancer treatment that we can expect in the near future? That you also highlighted some of the, breath analyzers and more research going on so that it gets detected early. But what about the treatment options?
And I think we have discussed a bit of it in the earlier discussions in the targeted therapy section. That means to understand the tumor in the right way is the way to go. So previously, the same we can call as a next generation sequencing or CGPs used to cost a few lakhs, now become few thousands. So with advancements in the computing, with a better learning curve, the cost is coming down. So it is becoming more and more affordable. That's also one of the key components of the innovation that I see. Right? It's not only about something new being invented, but the whatever is essentially is being made available to the public is also a part of the innovation. So that's one thing that happened. When I used to practice in 2002, the targeted therapy pill used to cost a lakh a month is now costing 1,000 a month. That means hardly 1% of the cost. So that's a big change that we have seen. Affordable and accessible medicines to the last mile of the people who are suffering from this dreaded disease is one of the biggest innovations I consider, other than the actual lab innovations that are happening. So we discussed about the screening, that is breath analyzers. AI has been touched upon by Dr. Manish for the better detection of the tumors, for segmentation of the areas where we should be focusing upon. The liquid biopsies, once and repeated, making it more accessible to the last mile. And most importantly, explainable artificial intelligence. That's a very self explanatory word. The moment I enter something, it should not feel like I got, out of womb, something came out like a magic. No, whatever it tells should be able to make sense to the doctor as well as to the patient. So that's what we call, FDA calls it as explainable AI as a diagnostic tool. So it's called software as a diagnosis. SAD is a word given by the FDA and CDSCO. So these tools help the doctor to explain in the patient in a better way. Okay, you're going to get X amount of benefit. The magnitude of benefit is this much. The anticipated side effects are these means, because pharmacogenomics can tell you what drug you can tolerate, what drug you can't tolerate, sort of thing, right? So there's something called polyomics, genomics, proteomics, metabolomics, that are going to actually personalize to tell at what point the treatment may fail and what preparation the patient and doctor have to do it. So these are the things which are no more futuristic. I think it's in the very near future. It is in the phase 2, 3 trials, means it will come very soon into the practice. So these advancements are available in few of these countries, and India catches up in no time. In a couple of years, I can see most of us using those apps to give the patient in a better way how to educate. And very importantly, the prehabilitation concept. That means if I prepare myself to face, it's like a preparation for a cricket match. So if I do better preparation, I can face the opponent well. So the prehabilitation concept of, before I start the treatment of the chemo, I need to push the nutrition up. I need to vaccinate them. There are cell therapies which are coming up in a big way, NK cell vaccines and dendritic cell vaccines. So if I keep on enumerating, the 1 hour time is not enough. It becomes a academic CMA. But just to sum up, AI, advancements in the better understanding of the genomics, availability of the cell-based therapies is the way forward, and everything in patient understandable language as well as physician understandable language should make sense. It's not like something from above coming and then just like a sort of thing, right?
Rightly said, sir. I think I really like the way you're comparing that cancer into a fight or a match where you have, the cancer is your opponent and you have to compete with it with all those skills and training. You have to train with the treatment, whether it is vaccine, drugs, chemotherapy, immunotherapy, target
Nutrition,
nutrition or the precision medicine. I think these all are the skills or that a cricketer or let's say a batsman is, facing the ball with his new techniques and everything. I think that's the way we can create awareness amongst our listeners and the patients out there. It should be in an understandable way. So thank you so much for comparing this and making this into a fight against cancer because we all are here for that. So yes, my next question is to Dr. Manish. So can you share insights on clinical trials currently underway for lung cancer and how can patients get involved?
I missed your question.
So can you share the insights on clinical trials currently underway for lung cancer and how can patients get also involved in this?
So there are plentiful of clinical trials which are being conducted, and uh, one very bad thing about the our healthcare system is that the most of the basic research which is coming to us is not from the our country or this part of the world. It is from the Western nation or from the European nations. So most of the time the clinical trials which are available to us in our countries, they are usually phase 3 or phase 4 clinical trial, the basic research which is not happening in even in the some of the biggest institutes in our countries. So most of that these researches they are being done now on the antibody drug conjugates, which are some of which are available and some of which are being tested. Some of the bispecific antibodies, which initially showed their the improvement in the hematological malignancies, now they are being researched in the lung cancer as well. Similarly, some of the vaccines they are being researched upon for the lung cancer. Apart from that, the cell therapy, cell-based therapy, CAR T cell therapy is also also in the horizon. It is mostly for the hematological malignancy as of now, but there are few of these studies in which these CAR T cell therapies they are being tried in the solid tumors such as lung as well. So the time is not far that we will see the introduction of these bispecific antibodies, vaccines based treatment, and CAR T cell based treatment in our clinics. But unfortunately, these trials they are not happening at a good pace in India at least.
Thank you so much, sir, for answering that question. And moving on to my next segment of the discussion is that is patient support and advocacy. Dr. Karthik, starting with you, how can patient support groups benefit individuals diagnosed with lung cancer? As we know, we have there's a lot of patient support groups out there helping out the patients, but how can individual actually get benefit from this?
Yes, this is again a very good question. From the patient's perspective, the first thing is the patient should have a positive mindset during the treatment. So that helps them to get rid of the disease half of the time. So the treatment which we give is the second half. The first half is the patient should have positive mindset. So for that positive mindset, the patient needs external support also, because we in our clinic we will be talking to a patient 10 minutes or 15 minutes, not more than that, and we'll be explaining more about the disease aspects and the treatment aspects, not in a not the other way, like social aspects we are not going to discuss. So for discussing those things, we need social support groups for, and that too specifically for each cancer we need, like Western countries. In India it is very less, but still the social support groups can be formed with patients, with the treated patients, already treated patients for the disease, and some non-profit organization people, and some doctors and some advocates who will be helping the patients to know about their well-being and their disease. What in what form it will help is, it will make the patient very comfortable. When the patient joins the group, they'll be very much comfortable. They can see the other patients who have come out of the disease in a very good manner. They'll see them, they'll have some when they see them, they have some positive approach, and they'll have their reduced feeling of loneliness, anxiety, and also they'll get away from the distress about the disease. And they'll learn from them about the new ways of coping up from the disease. They'll get advice from them how to transform from this phase to this phase, all those things that can help them. And the other thing is, it provides they provide some information about their treatment and the importance of having the treatment in a proper way and in a proper time. All those things, those social support group can help them. And also they'll help them to communicate in a way which will be better, to come better in terms of communication with the doctor as well as to the public people, because they'll be already in a very depressed mood. So we have to make them come out of that mood, and these social support organizations can help them to come out of that scenario in a very well manner. So we need that support for our patients, and in many a times in the local languages, that will help them better. So that each and every state in our country, I wish each and every state in our country have that social support group for each and every cancer. That will help them very much, and they'll be benefited out of it also.
I think so. You pointed out a very great point that should also be available in a local or regional language that can sometimes help, because the patient is not really well educated or comes from that strong background where they are able to understand the medical terminologies, or the doctors are trying to communicate them. So I think that is a very good way to bridge the gap between the patient, the family, and the treatment, or let's say the hospital and the doctors are trying to communicate to them. So that is one of the biggest help, I believe. And you rightly pointed out that, sir. But thank you so much for bringing that point. My next question is Dr. Suresh. So, what role do caregivers play in the treatment and recovery process? So, you're on mute.
Right. Caregivers are the pillars of the treatment. You know, they accompany the patient throughout. They will encourage them. They will take care of the patient when the patient is back at home. They give psychological support, physical support. They'll give mental support in terms of, okay, all is going to be well. Financial support, obviously, a part of it is usually taken care by these people. They play a significant role. Just going back to the analogy, it's like walking back a couple of steps and then just asking your co-batsman, okay, hey, what is happening, sort of thing. Like the other patient is going to give them small tips on how to deal with the nausea, how to deal with the vomiting, or maybe how to deal with the depression, sort of thing, how to come early, starting from the travel, whether to try take a bus or a car versus a train. These things, and what food you need to pack, these things do matter. I mean, these things usually happen in the wards of the or the corridors of the chemotherapy ward. A lot of exchanges happen. Even doctors, we learn when these two people keep on, hey, I mean, don't put this thing, put some bit of adrak, which is going to reduce the nausea. Yes, that is right. Gingifer officinalis is one of the strongest antiemetics if you use it in the right ways. So, very small, tiny tips the caregivers will give to each other in the wards or corridors, rightly told by Karthik. Okay, this forms a small society by in itself. This called patient or caregiver societies, and we in our hospital have a very unique way of I can say encouraging or I can say felicitating the winners. We call as the cancer warriors. So once in a month we do it. Those who help each other, sort of thing. It's like a cheering happening in the stadium, sort of thing, right? So they get motivated to fight the cancer in a better way. So it's not a classical social group, but all the caregivers, all the patients come together, and we, as the nurses and other things, say a few positive words to them to help them in carrying on the journey for the fight against this cancer, right? And lung cancer is no exception. We have close to 100 people who are a part of this short group, forms both patients, caregivers, and past patients. So the exchange of knowledge is very rich there. I mean, doctors, we do learn from them. I mean, a lot of learning from them, really. We appreciate and we salute them. It's not easy to fight this disease.
It is not easy to fight this disease, sir, and caregivers play a very important role, the family members, the doctors, and every other person who has a very crucial role in a patient's life. And without their support, I think that becomes very difficult because the patient goes through a lot of emotional turmoil, and it is not easy to handle all those things by self. So caregivers, there comes, I think, like a support. They understand, and also sometimes they also go through a lot of negative things, negative environment, all such anxiety around them. But they handle it very well, and they try to handle the patient as well. I think that's the support that the caregiver can only give to a patient, and it tries to make the journey a bit easier, and with the support of that. My last question is Dr. Manish Sharma. So, what are some resources or organizations that can provide emotional, financial, and medical support to lung cancer patients?
So there
So,
are a few of the.
not
Hello,
visible to us, sir.
am I audible?
So you are audible, but you're not visible to us, sir. There's something in front of camera. We cannot. Yes, we can hear you. We can see you now.
So there are few of the organizations which are NGOs and other are government organizations. So few of our patients which are not that well to do, they can receive some of the funds from the PM Relief Fund. So when I was in Rajiv Gandhi Hospital, we used to fill some forms and the patient they will get around 3 lakh rupees as a financial aid from the PM Relief Fund. Another is the CM Relief Fund, Chief Minister Relief Fund, from which the patients they can get approximately 3 to 5 lakh rupees. Um, the process is similar. We fill some form, the estimated cost and the diagnosis, and these patients they get some 3 to 5 lakh rupees of help from CM and PM Relief Fund. Then, apart from that, there are a few of the NGOs, such as Indian Cancer Society, which help in spreading the awareness, and it helps also some patients financially by giving 50,000 to 1 lakh rupees for those patients who are treatable patients who are in stage 1 to 3. Then there are few crowdfunding platforms also, which few of our listeners might be knowing also, such as Keto, Milap. So these are few of the crowdfunding platforms where the patient they can reach up for some financial help as well. Apart from that, there are few other NGOs like Tata Trust NGO, We Care Foundation, which helps in the awareness process also, and they run these kind of financial helps also.
You rightly pointed out, sir. These are few of the organizations which are helping us in support of all the other aspects, and PMJAY is also one of a very good organization that is not only helping in the treatment process, providing that financial aid, but also being there in a market as assurance that the government is there to help you out. to, let's say, morely towards a weaker section of society, because we all agree that a lot amount of money goes into, medical sector treatment or any of thing, if something has happened to a family person. So in that case, the government schemes, such NGOs, such bodies are a great help. And I think with
Just to
this,
add one thing, even the
so
MNCs and few of the pharma companies are coming with the patient assistance programs. That's also helping, right, Dr. Manish?
Right, you're very rightful about that. So, few of the drugs which are way too costly, which usually the patients they are not able to afford. The MNCs and the pharma companies they are coming up with the patient assistance program. Just for example, one of the drug which is immunotherapy, which comes in the name of nivolumab or pembrolizumab, it used to cost somewhere around 40 to 50 lakh rupees a year. And with the help of the patient assistance program, the drug cost has come down to barely 10 to 12 lakh rupees a year. So this is also one of the things which the patients they should definitely discuss with their treating physicians when they go for the treatment.
that is a great done work by the pharma companies and other players present in the market who are into this sector. And in any case, through the clinicians, through the patients or the patient support groups out there, can they are making the voices reach out to them, and how can we help the patients and the family in the treatment process, in the treatment journey, to make it less complicated, easier, and bit supportive. That is all a patient and the family requires. But thank you so much to all the panelists for coming to this panel discussion and becoming the strong voices to raise the awareness on lung cancer. Because, like Dr. Suresh said, starting in the starting, that the main cause is smoking, smoking, and smoking. Whether you're actively smoking, passively smoking, or the smoke is just in the room, or any form of tobacco, or any other case. Because despite doing all such things, people still do it. They know its harmful effect, they know everything what it can cause to them, they're still doing. But with sessions like this, we want to emphasize more on this. We want to raise awareness to all those people, to reach out to them who has not even got into this kind of habits or anything like that. So thank you so much to all the panelists present here, for sharing your insights, expertise with us, for raising this awareness and coming to our platform, sharing, giving your time to us. Thanks a lot, it means a lot to
Yeah.
us.
Yeah, thank you,
Thank you.
ma'am. Very well organized
Thank you.
questions again to reach out for the public, because this will help them to know better about the awareness of lung cancer, and also will educate the patients and to help them out to have proper treatment in a very good way. Yeah,
Thank,
thank you. Thank you for that again.
thank you so much, Dr. Kant.